What efforts help regain bladder control for urinary leaks? Imagine waking up one day and realizing your bladder isn't as in control as it used to be. Managing urinary leaks involves a mix of simple lifestyle changes, exercises, medical options, and sometimes devices or procedures. The best approach depends on the type and severity of the leak, as well as individual health factors, including bladder health and any history of bladder cancer. Starting with lifestyle and behavioral changes can make a big difference. Bladder training is a common method where you set scheduled times to go to the bathroom and gradually extend the time between visits. This helps your bladder learn to hold urine longer. Avoiding bladder irritants like caffeine, alcohol, spicy foods, and artificial sweeteners can reduce urgency and leaks. Maintaining a healthy weight is also important because excess weight puts pressure on the bladder and pelvic muscles, making leaks more likely. Managing fluid intake, especially limiting fluids before bed, can help reduce nighttime leaks. Pelvic floor muscle exercises, often called Kegel exercises, are a cornerstone of bladder control efforts. These exercises strengthen the muscles that support the bladder and urethra, helping prevent leaks caused by physical activities like coughing or sneezing. Doing these regularly, often guided by a pelvic health specialist, can significantly improve control over time. Medications are another option. Certain drugs like anticholinergics and beta-3 agonists relax the bladder muscle, decreasing urgency and the frequency of leaks. Sometimes, tricyclic antidepressants are used to calm bladder spasms. For more stubborn cases, Botox injections into the bladder muscle can help by relaxing it, increasing capacity, and reducing involuntary contractions. These injections usually last several months and may need repeating. Medical devices can also support bladder control. Pessaries are devices inserted into the vagina to support the bladder and urethra, mainly helping women with stress incontinence. Urethral inserts, similar to tampons, are placed before activities that might cause leaks and removed afterward. For severe cases where the bladder cannot empty properly, catheters may be used to drain urine. Nerve stimulation therapies offer another avenue. Sacral neuromodulation involves implanting a small device under the skin that sends gentle electrical impulses to nerves controlling the bladder, helping improve its function. Percutaneous tibial nerve stimulation is a less invasive outpatient procedure that stimulates a nerve near the ankle to influence bladder nerves, usually done weekly over several months. In cases where conservative treatments do not work, surgical options are available. Sling procedures use a supportive sling made of synthetic mesh or tissue to lift and support the urethra and bladder neck, mainly for stress incontinence. Bladder neck suspension surgery supports the bladder neck and urethra through abdominal surgery. For severe cases, an artificial urinary sphincter can be implanted, acting like a natural valve to control urine flow. Women with pelvic organ prolapse contributing to incontinence might also undergo prolapse repair surgery, sometimes combined with sling procedures. For those with a history of bladder cancer or other bladder issues, it's essential to work closely with healthcare providers. Treatments should be personalized, considering bladder function, previous surgeries, and cancer-related changes. Always consult a urologist or pelvic health specialist to develop a safe and effective plan. Overall, regaining bladder control often starts with simple lifestyle and behavioral changes, advances through medications and devices, and, if needed, involves surgery. Each step is tailored to the individual, with professional guidance helping ensure safety and the best possible outcome. Remember, every person's journey is unique, so seeking personalized medical advice is key to managing urinary leaks effectively.